Healthcare workers are warning of a critical shortage of life-saving supplies. As Jeff Semple reports, one doctor in Toronto is appealing to the public for donations.
It's fast become a must-have accessory. These surgical masks donning faces across the country. But while customers are stocking up, hospitals are running out.
Every time I see someone on television wearing a mask, whether it's a surgical mask or an N95, it really makes my stomach turn.
This emergency room doctor says some supplies at his hospital could run out in less than a month. Staff have been told to conserve and not wear masks unless absolutely necessary.
We should only be routinely using protective equipment for patients who have a diagnosis or have, very, sort of concerning symptoms. And so that's where myself and quite a few of my colleagues are feeling uncomfortable.
Ontario stockpiled 55 million masks after SARS, but those have since expired, forcing hospitals to compete with the public to purchase more.
Putting a mask on someone who's sick makes perfect sense. Walking around the city wearing a mask intermittently, there's no evidence to say that that's going to help you.
The masks are required to protect both patients and healthcare workers. In Italy, nearly 10% of frontline hospital staff have been sidelined with the virus.
It's in everybody's best interest to protect us right now because at baseline, we're running at 110%.
Starting Monday, this hospital in Toronto is inviting members of the public to donate and drop off unused, unexpired protective equipment. So anything from surgical masks to protective gloves, even goggles for health officials to use on the front lines of the outbreak.
Another life-saving item in short supply, ventilators. These breathing machines for critically ill patients. This Toronto area company is in talks with the federal government to dramatically ramp up production of these portable ventilator units. But each one typically takes more than 20 hours to build.
We'll definitely be running additional shifts. And then once we understand what the demand is adding additional people as well.
The Prime Minister says Canada is ready for the anticipated spike in COVID-19 cases.
We are confident in our capacity to ramp up to provide protective equipment for frontline hospital staff and others who need it.
But many of those on the front lines don't share that optimism. Jeff Semple, Global News, Toronto.
COVID-19 is especially difficult for grieving families. Unlike many other events, funerals are not something you can simply postpone. But as Amanda Jelowicki reports, funeral homes are adapting.
It's probably the hardest thing a family has to experience, saying a final goodbye. While funerals normally unite families, the COVID-19 crisis is forcing them to stay far apart.
Unfortunately, we're all in the same boat. I mean, the whole world is in this situation right now, so we're just trying to figure out some ways to help our families.
Across the country, funeral services are adapting to the new reality of social distancing. Families are encouraged to organize funerals over the phone or internet. In Montreal, most funeral homes are restricting services to 10 to 20 people with video streaming options.
We are offering some web-based funerals in two of our homes, one in Laval and one on the South Shore, so that people can attend a funeral and the families can attend from a distance.
They're all practical options people are adapting to, but for grieving families, it's difficult.
When we experience mourning, it's very important to have the support of friends and family.
Some are postponing funerals for a few weeks. That isn't possible for some religions, like Islam or Judaism, where burials must happen quickly.
Out of respect for the dead, funerals are meant to be as soon as possible after somebody dies.
Sitting Shiva is a fundamental mourning process for the Jewish community. That's when friends and family visit for a week after a burial. Not being able to do that is devastating.
It's really valued, a really important practice. And so the people who aren't able to do that now, there's no question in my mind that it's a loss on top of a loss, but there's equally no question in my mind that it's the right thing to do.
Hugs, so important at funerals, are now also discouraged. Instead, it's recommended people touch hands to hearts as a symbol of love and compassion. It's the new normal in a world that is anything but. Amanda Jelowicki, Global News, Montreal.